Hello, thanks for joining us guys, thanks for supporting us and everything, and hope these videos are useful and entertaining for you guys, and hope you get something useful out of it. So, today we're going to talk about kidney disease. We're going to talk a little bit on the lab work part of it, because that's what we're going over a lot of times, and I've been seeing a lot of kidney disease, so try and keep it as up to date and current as I can with you guys for what I'm clinically seeing. So any patient can get it, younger patients can get kidney disease if they get into something toxic or those types of things. We're going to kind of focus more on our older patients that are getting it from just straight kidney failure. There is a difference between acute kidney failure and chronic kidney failure. Acute kidney failure, they typically get it quickly. Usually it's in a younger patient, maybe a middle age, they got into something or something pissed off the kidneys and they're an acute kidney failure. A lot of those patients we actually do really well with, and if we catch those within the first few days, we can actually reverse a lot of that damage and do wonderful with it. Chronic kidney disease is where most of our patients will fall into. The older you get, the less things function, the less things work, just like in people. You get more crunchy, you get more arthritic, you get more everything, can't see as well, you fart more, you burp more, things happen. So, chronic kidney disease, it'll present a lot of different ways. The broad, simple things are anorexic, lethargic, and then we never know till we start running blood work and we rule in and out kidney infection, liver, electrolytes, so on and so forth. For kidneys, what we were looking at on our blood work typically are creatinine, BUN, phosphorus. There are some other values you can use to suggest acute versus chronic. Every doctor does things a little different. Depends who trained them, their experience, and then what references they're using. Creatinine is probably our biggest indicator for it. It is very specific for the kidneys. It is not the only thing in the body that has creatinine. Muscles are another one. So if we have trauma, I can have elevated creatinine values and BUN values because those enzymes are also in muscle, not just in the kidneys. So if I got hit by a car, I traumatized muscle, I release a lot of those things. That's probably going to be more of an acute kidney issue. A lot of those will resolve because once we resolve the trauma and we get all that body filters all that and gets it under control, it's not a chronic issue. That's what it was. It was an acute problem. Another one that'll get elevated on blood work that really makes these patients feel like crap, kind of flu symptom-like, just not feel good, would be high phosphorus. Phosphorus, when it gets elevated, it decreases appetite, makes you feel like poop. Flu symptom description is the best way for me to explain that. It's like having the flu when you have really high phosphorus. There are some medications we can use for that to drop that down and have pretty good results with it overall. Just because a patient has chronic kidney disease doesn't necessarily mean it's a death sentence. Everything is in proportions. How long has it been going on? How severe? How well does the patient respond to treatment? Will they eat the kidney diet or whatever the medications are for them? Those patients that do tend to do better than those that don't. Next, can the owners give the medications? All these things start to play a variable with prognosis and outcomes and things like that. In veterinary medicine, we do not have dialysis machines like they do in people. When they have kidney failure, they hook you up to a dialysis machine. What that means is they have an IV catheter in you, they suck your blood out, they have another catheter where they're pumping blood in. When they suck the blood out, they are basically filtering your blood through dialysis through a machine instead of the kidneys because your kidneys are not working. And once it goes through the dialysis machine, then they pump the clean blood back into your veins, your vasculature, and then it goes through. So it's a way of detoxifying, decluttering, defiltering, whatever you want to call it, the blood. Veterinary medicine, we don't have dialysis, especially in general practice, at least not to my knowledge. Maybe that'll change one day. That would be really cool and fancy. So hope it comes. Technology is impressive and amazing and it changes all the time. It's part of the fun with veterinary medicine. Veterinary medicine, we do not have dialysis. So what we do is we typically try and do fluid dialysis, so we hook them up to IV fluids. And here, typically, we'll try and do about 72 hours of IV fluids, plus some other medications and things. And that's kind of our version of dialysis because we don't have a machine to filter out their blood. More so, the principle is the solution to pollution is dilution, aka the fluids, we're trying to dilute the toxic levels in the blood that are affecting the body. And usually the gold standard at the moment is 72 hours. So that's what we always try and shoot for when we have those patients that have chronic kidney issues. I see all kinds of variables, guys. The vast majority, when I do that 72 hours, a lot of times they live for months to years. There's always an exception with everything. I have had patients that do great for a month and then crash. I have had one patient who had great values after we did it when we repeated blood work, and then in 7 days crashed. That is only had one patient that did that. But it does happen, and it is medicine, and it's not predictable. It's not black and white, it's not math. There's no guarantee with medicine. But the vast majority of patients, when we do that, we actually buy you quite a bit of time. How much? Too many variables to give you an exact number. So, hope that's helpful and useful for you guys and something you might not have known about veterinary medicine. And thanks again, guys. We appreciate everything you do for us. Take care. Bye.